Hello, everybody. Thank you so much for joining us on our How to Create a Virtual Waiting Room webinar. I am Tyler Kushner, Account Manager. With me is James Herman, or Jim Herman, the CEO. So what we're really going to do today is, in our format's going to be about a 30 to 40 minute presentation of a virtual waiting room, what it is. Jim's going to share the software, what some of the functionality is behind it. And then in the meantime, or afterwards, we're going to take about 15 minutes of questions. In the meantime, if you don't mind, send your messages and your questions into the chat box, and we will try to answer them along the way. So without further ado, Jim, I really just wanted to start this off by asking you, what is a virtual waiting room?
Thank you, Tyler, and thank you all for joining this webinar. It's for our great customers and our customers only, and so we thank you for not only being our customer, but also joining us today. There's been a lot of talk of what a virtual waiting room is in the healthcare space. And so I kind of want to just kind of scope our presentation for today because there could be a lot of different definitions for it, a lot of various ways people think about that. So we think about a virtual waiting room as virtualizing an actual outpatient ambulatory waiting room, right? So taking your waiting room and making it virtual, kind of eliminating the patients from it, and taking that to an online space or to a software space, and therefore you'd have a different process for that. What we will not cover today is telemedicine. So there's a lot of virtual waiting rooms in the telemedicine world. That is not something we'll cover. We're covering virtual waiting room in terms of social distancing, something that's come about due to the coronavirus and wanting to keep patients safe, flowing them in from outside your facility into receiving the healthcare services that they're there for. And also, we also think of a virtual waiting room as something to engage patients, a way to engage them prior to the visit, right? Helping them arrive in a smooth fashion. And like I said, starting from the visit from outside the facility and queuing and flowing patients in a way that we've really not probably ever done before. Okay. More specifically, kind of a definition is what we call it: a patient virtual waiting room is a patient engagement tool and a process that you build that facilitates safe patient arrival and social distancing. And so, more detail on that, really thinking about eliminating the physical constraints that you may have with a waiting room, with a physical space. And so, virtual waiting room essentially eliminates that. The engagement that you can do through text messaging patients prior to visit and communicating with them is very powerful. You can use that to inform patients on maybe things they need to bring to the appointment, educate them on certain things that they need to understand prior to coming to the appointment or right before the appointment, and actually directing them and helping them wayfind through the facility. And so if you're changing your process, maybe you want to send a text to them, certain patients to come in the red door and go to the green line and down to a desk or an area. And so giving them directions can also be something that helps with a virtual waiting room and flowing them in, providing them status and timing, right? And so because you can't see patients, you don't know really where they are in time. And so having a virtual waiting room that provides status and time, that the patients arrived in the parking lot, they've been sitting in their car for 15 minutes, bringing them in, checking them in, etc. So having a status of where the patient is at and timing that arrival and the steps in that arrival that may be different than what you were doing before is really, really important. Setting and managing expectations. Also having ways to communicate and engage patients and set expectations. Things like, sorry, you've been waiting 10 minutes. We'll be with you very soon. Okay, so we can a way to use tools to set and manage expectations in a different way because you cannot see the patients, right? And create and maintain a connection with them as they're arriving for their appointments, engaging them in a way that creates a connection. And so virtual waiting room really helps us do all of these things without physically seeing the patient. Okay, so that's really what we call the virtual waiting room in terms of patients' arrivals.
Okay, great, Jim. So what do all of our wonderful customers here need to think about if they're considering a virtual waiting room?
Sure. So we've been doing the virtual waiting room since, I want to say early April. So many of our outpatient centers were shut down, and we're not doing elective procedures or many outpatient procedures, non-critical procedures. And so by April of this year, we started to get inquiries and calls from our customers saying, how do we do this? Are we going to put blue boxes on the floor or X's on the floor like Walgreens, or how can we get our patients coming in and providing the social distance for their health and safety, right? So things to consider if you're going to go virtual with your waiting room is, how do you arrive patients today, right? Do they come into a kiosk? Do they come into a desk? Do they come and sit down and you call them up? Does the staff come in from another area and call them to an area where they're going to be receiving service? So think about, how do we arrive patients today, and how would that change if we had to, quote unquote, arrive them without seeing them, okay? Obviously, we have roles that will change with this. So the staff role of that patient access person, or those registration folks, what is their role in the arrival, and how is that going to change, right? Are they going to be managing a separate tool now that helps you maintain patients in the parking lot and communicate with them, whereas they used to just be in a 20 by 20 room and you could easily see that they're here and communicate to them. So the staff role in arriving patients is something to consider, because it will change, right? Patient flow, does this need to be altered? Do we need to move patients into safe areas? Do we need to change where the doors are, the flow of patients, et cetera? And so when we really consider social distancing, what is the flow of a patient? We don't want patients kind of bottling up and being too close together. So the flow of how you bring patients into your facility, how you flow them through your facility, really starts potentially at a virtual waiting room, and may need to be altered, right? Think about your EMR or your practice management system. Does that system have engagement pre-appointment? And we're talking real-time pre-appointment, 5, 10, 15 minutes before appointment, during appointment. Does it have ways to engage? Does it have queuing functions built into it? If it does, that could be a way you can just consider using your EMR or practice management system for that, right? Obviously, we need to consider the population, right? Are your patients mobile users? The vast majority of people are, even older folks these days. But also know that 80%, we talk about an 80% rule. If you can get 80% of people to follow a process, you're going to have success with that process, right? It doesn't need to be 100%. There's going to be people that don't have a phone, just walk right in, that type of thing. But we should be able to handle that and have a nice process. We've seen folks put together a really great process, even if they only have 80% of the patients following it. And so it doesn't have to be 100% from our perspective, but it has to be enough so that you can control the overall flow through controlling enough of the folks responding to your process. Okay, parking lot considerations, right? Is our parking lot well lit? Is it, does it make sense for us to stage people out in their cars? Is it safe for them to be there for 15 or 20 minutes if necessary? Is it a parking structure that's got 4 feet of concrete all around them, and now they're not going to be able to get a text message out there? So parking lot considerations, where, if you're not going to have a waiting room, where are the patients going to wait, and are they going to have communications out there? We've also worked with many clients on signage, wayfinding, having them provide instructions outside of the building or maybe on the doors. Please text this number to sign in, or please follow these considerations once you enter the building, right? So things to consider when you have a virtual waiting room that'll change your process and how your patients approach and arrive to their appointments, right? And so as we all know, successful implementation of a new tool and process requires planning, just thinking ahead of these things. What do we need to do to change in our process so that we can foster a safe arrival?
Great, Jim. Thanks so much for that. As we move forward and get into the software itself, please remember to chat in any sort of questions you may have for us. We will actually bring them up here on the webinar. and answer them for you. Kind of a Q&A as we go type deal. So, Jim, with every consideration in mind and what is a virtual waiting room, what are some of the examples that PatientTrak has done to create a virtual waiting room for our customers?
Sure. Let's talk a little bit more about sort of the basis of our solution, and I'd be happy to provide some great examples. So this is kind of the building blocks of a virtual waiting room. And we start over here on the left side with having the appointments in PatientTrak, or having in your system, whatever system that is, access to the appointments, right? And a big part of that is having a time frame or a forecast of those appointments, that we know who's coming up, right? And that we have a way to send out some kind of link, some type of message with a link to the patients prior to arrival, right? So we've seen customers that want that 15 minutes before arrival. We have other customers that want that a whole hour before the arrival, that the patient receives some kind of link to let them know when they've arrived, okay, and wherever that arrival is, okay. So we can send out a link, a simple link in a text message that says, "Hello, Tyler. You have a patient. You have an appointment at 9 o'clock. And when you get to the parking lot, please click on this, park your car safely, and please click on this link to let us know you're there," right? And so Tyler comes in to the parking lot, parks his Lamborghini, and he hits this link, right? And he hits this link, and now we know, right? And that can do, from that information, we can do a lot of things. It'll obviously give us that status that Tyler's in the parking lot within PatientTrak, but we can also send that information over to an EMR or an EHR or your practice management system. So if you want to primarily work out of that system, we can have those messages relate back to a status in your EMR, right? All the while, Tyler remains outside the facility, sitting in that cool car and just waiting to come in. When you're ready for the patient, right, you can send them a text message to come in, okay? And that could be, maybe things are running a little slow, maybe you're running a little fast. That's great. Whenever you're ready for the patient, you send them a message, they receive that, and the patient presents. And so all the way along, you're communicating and you're managing that flow and managing that social distance. Okay, so that's kind of the building blocks of what we do here at PatientTrak. There's several derivations and actually customizations we put together for this. So I'll just give you 3 examples of what we've done. So ACL Laboratories is a large community laboratory in Chicago, in the greater Chicago area, and they had to completely transform their business model. They've taken great pride, as many community labs have, in always being available for patients, always having their referral sources, and not needing any type of appointments. They had to transform their business model. They now have to have appointments. They cannot have 6 patients showing up in a small waiting room all at one time that all came from different doctors' offices, referrals, right? So we've helped them transform that using this system. They went from really 100% walk-in to nearly 100% scheduled appointments. And they're doing that using the PatientTrak online self-schedule. They're distancing those patients now, even in 15-minute increments, because that's kind of the cycle time of a lab. So socially distancing those based on those appointments. They also put up in some areas on-site signage to direct patients to self-schedule. If they were a walk-in, they can hit a link or hit a text, a number, and sign up right, in real time, and then they're allowed into the facility. And it also ties in pretty well with their call center. If patients call in and want to book an appointment, they can also do that as well, and they use our system to do that. So ACL Community Lab transformed how they do business because of COVID, and our support of that was pretty amazing. Akron Children's, we're doing thousands of appointments a day for all of their outpatient and ambulatory areas. They are using our integration through the Epic App Orchard. So they're doing their texting from within Epic, even though it goes out through PatientTrak, and the mobile links and all of the statuses come back to PatientTrak, as well as go back into Epic. When the patient has arrived, they actually have a little blinking car next to the patient in the DAR on the Epic solution on the Epic app. And so their patient feedback has been very positive. We see this as something that's not going to go away when hopefully COVID goes away as soon as possible. But patients having this level of engagement and education and direction prior to the appointment is very positive for them. The third example I'd like to bring up is Houston Methodist, large volume radiology. We're connected to their Epic system. We connect to many, really any EMR. So if you have Meditech or Cerner or really any EMR that has HL7, that's really the key to getting those appointments in our system. And once we have the future cast of those appointments, we can start to run campaigns and get the virtual waiting room started. So they're using it to control flow. They're also using it as, the start of their door to discharge tracking, right? And so many people on our call here use tracking, door to discharge. So just think about this, just starting out in the parking lot, right? We don't start in the waiting room. We start in something, an area. We create an area in our PatientTrak system that's not inside of our building, okay? Pre-facility or whatever you'd like to call it. And so, and then we can also send specific message types for specific patients. We can also send message types by doctor, by treatment type, that type of thing. So we can get very customized with how we're, communicating with patients and making sure that they have all the information they need to succeed.
Okay, perfect. Thank you so much for that, Jim. Everybody, just want to remind you to send in your questions on the chat. I think it's probably time we give them what they're here for, and that is to show them the software and demo what we can do.
Absolutely. Okay, very good. I'm going to bring up both the PatientTrak screen. This should be familiar to most of us on the call here. And I'm also going to bring up a representation of my phone, my own cell phone here, okay? And just to show you that we have a patient in here. We'll go back to the patients here. So this is showing our appointment schedule for today. We have Jimi Hendrix and Neil Perk here. And Mr. Hendrix has an appointment at 11:35, which is coming up. And as we can see, we have some information here from his schedule, his MRN, his date of birth, et cetera. But he's just an appointment at this point, right? He's not a real patient. He isn't scheduled to be here for another 15 minutes, okay? However, we have a campaign that runs 15 minutes prior to the appointment where he should be receiving a text message letting him know that we have a virtual waiting room and that we'd like him to check in. And so let me show that to you. So I have that set up on my phone here. Okay. And so it says Life Healthcare message, and that can be the name of your facility or however you'd like to header those messages. And it says, "Hi, Jimmy, please click this link after you have safely parked in the parking lot." So he just got this about 15 minutes, 20 minutes before his appointment. And I'll show you here, I'm clicking live. This is a live version on my phone. I click on that, and up comes a little box that says, Life Healthcare Center, mobile sign-in. Please park your car. Click the link below. Okay, so you got this text. He's parked his car. You hit the link, right? And now he's going to come back to us and say, "Yep, I'm here." And it says, "Jimmy, thank you for signing in online." Also, you can see he also got a text message that said something very similar. And so, it can show here what his text message was. So it said, "Thank you for signing in online. We'll be with you shortly." Okay, so we've sent out a message to him. He reacted to that message stating he's here in the parking lot. Automatically, another thank you message was sent to him. We've already had 3 communications back and forth between the patient and the PatientTrak system in our virtual waiting room, and we haven't even seen the patient yet, right? We're already engaging with him or her, et cetera. Okay, and so when we look at the patient tracking system, we go in here and now Jimi Hendrix is gone from the appointments, right? He's no longer an appointment because he told us he's in the parking lot. So let's look on the tracking board on the parking lot. Let's look at our patients in there, and there he is, right? He's in there with Elvis and Kurt Cobain, right? So here's Hendrix. He just arrived at the parking lot, and we just started timing him. It's been 1 minute since he entered the parking lot, and 1 minute since he's been basically his appointment has started, and he's part of our operation now. He's no longer an appointment; he's an actual patient. Okay, and so we can flow patients through the parking lot as they, rather than starting in just the lobby, and we can say, okay, Elvis, he's going into the lab. So now we have a few patients in the lab, and then now we also can take, patients and just start flowing them through their normal course of receiving healthcare services. Okay, but we can always look back and say who's in the parking lot, how long have they been there, right? They're not physically in our site necessarily, but they're out there and they're ready. Okay, and so when we're ready to arrive the patient, right, we can just click on here and say, we're ready for you now. We can have very specific messages in here. If you're not familiar with PatientTrak text messaging, we can create a list of messages. We call them one-click messages. So we create a message one time, save it in our list, right? And because we're going to be using the same messages over and over, so there's no reason to type them. So we can save them on a list here and use those messages and have specific messages for patient types, types of appointments, etc. Okay, and so we can take this message and we can say, okay, we're ready for Hendrix now, and we can say we're going to just click on find him on our list here, click on his phone number, and click on a message that we can send to him. Okay, and so that message goes out to him, says, welcome, we're ready for you now. I'll switch over to my thing here. Right here is where it is. So now you have 3 messages here. The original one with the link, the auto reply to his hitting the mobile link and letting us know he was there. And the third one here, welcome, we're now ready for you. And here's an actual piece of extra information or wayfinding that can help us. Please enter the main doors, turn left, proceed to exam room 2. So in this case, we're sending them right to an exam room. There's no need for him to stop at a desk, congregate with other staff or patients. He can be walking right to where he needs to be. Okay, and so we've done all of this, just with text messaging and managing this patient where they're at and through the communications that we have. Okay, so now that he's coming in, we're going to go and put him in exam room 2. Okay, and so now we've got Jimi Hendrix in here. Let's just see what his experience has been with us. It's going to be real short because it's only been 3 minutes here, but imagine this a little more elongated. So if we go into the patient detail here and look at, where have we been with, here. Okay, so we can see down here what's happened with the patient here, and we can look at the text message, the history that we already have with this patient after a few minutes, right? So at 11:16, the auto appointment reminder went out saying click on this link. The patient clicked on this link, that mobile sign-in link, and we sent him the second message, and now we have the welcome message welcoming him in the facility. So we've arrived him and got him safely to where he needs to be. So I think that's a good first overview demo. I think if anyone's interested in understanding more or how to set one of these up, we'd be happy to speak with you and give you your own demonstration. We're also recording this so that we can send this out to you if you'd like to send this to some of your other colleagues. We'll have this as a recorded presentation as well.
Okay, great. Thank you everybody so much for joining. What we're going to do is send out an email to everybody with our contact information. So if you'd like to learn more, get a little more in depth with what we have in regards to a virtual waiting room, please just give me a call or email us to let us know what you'd like to learn more about, and we can take a deeper dive into that. Other than that, just thank you so much for coming and spending some time with us. And Jim, do you have anything else?
Yes, I would like to thank you as well. just to give you a little bit more detail on the solutions that we have here at PatientTrak. So what we talked about with the virtual waiting room is really in the light blue part of our patient cycle here. Just to let you know, you may not be aware that we also have satisfaction surveys, reputation management, scheduling, appointment reminders, other ways for you to help measure and monitor and improve your patient satisfaction. So again, I personally thank you for coming. Here's our contact information. Like I said, if we would be able to send out a link to this video, and if you want some more information, please let us know.
All right, everybody. Thanks so much and have a great rest of your day.